Now, privately owned and managed healthcare group Clinix, in partnership with the South African Scientists Society, are calling for nominations for the inaugural South African Health Excellence Awards. Nominations will close on the 18th of October. And here to tell us about the importance of these awards and other issues related to the health sector is Dr Dumani Kula. He's the Deputy CEO at Clinix. Thank you so much for joining us. Clinix was a brand started to bring about like black excellence and started by black people. Take us back to the origins of this brand.
Good morning, Desiree, and good morning to the viewers. Clinix has a very special story. Started in 1992, and our first hospital, actually, which was only subsequently incorporated into Clinix, was started in 1985. It was the first black hospital at the time in the 1980s. You will know the history of the country at the time. You know, black doctors and black patients were not accepted in the so-called white private hospitals.
Unless they were assistants or some such.
Exactly, yeah. So, and really, and what happened at the time is that a group of predominantly black professionals and, of course, black doctors and some black businessmen at the time, they came together. They started what then was called Lesedi Hospital in Diepkloof in Soweto.
Which continues to operate successfully.
Yeah, absolutely. And it remains our flagship hospital, close to 300 beds now. And we've just invested about 200 million rands in refreshing it and expanding the facilities there. So that was the story, and the likes of Dr. Nthato Motlana, who was a giant in the politics and just in general society. He was amongst the group really that pioneered this back in the 70s and the 80s. And Clinix itself was started by Dr. Kop Matseke, who actually was mentored by Dr. Motlana.
Who has not been celebrated enough himself.
He has not been. He has not been. And we often talk about that actually we still in a way have got the privilege of having people like him who have carried on, this legacy, and translated what the likes of Dr. Nthato Motlana were seeing back then. And Dr. Kop has taken, that dream, back at the time, it was just one hospital. So we now operate 6 hospitals. And
in townships?
Predominantly in townships, and that's really been our focus. We're still the largest private hospital operator in the group, in the country. And no one really has been, able to do private hospitals, just focus in the townships like we do. And we're about to actually expand the group. There's a new hospital that we're about to launch in Soweto, in Protea Glen. It's going to be our 3rd hospital in Soweto. We have just done our first transaction to do a cross-border transaction. In Swaziland, we are building a hospital. We actually started in September, and we're building a day hospital right in the middle of town. So the history, is rich, and the legacy continues, and we're quite excited, where we are today.
So we have this conversation in a week where the biggest story of the week was a black-owned bank where public money was funneled into this bank and given to other people who are not even related to what the bank is trying to achieve, erroneously. What can we learn from Clinix's success in terms of governance? How have your group managed to steer clear of such controversy? Look,
I think our view is that I think to the VBS story, and that the fact that there are black people involved, and I think, as you know, in our country, we have stories where, companies go through issues of governance, and it's not always a black. And I think a poor governance can happen in any organization, big or small, black or white or private or government. And I think our focus really has, we're a family-owned business predominantly. We now have recently onboarded the PIC as one of, in fact, as the largest institutional investor in the group. So governance is quite critical for us. As you know, the PIC is constantly in the spotlight, and we've invested quite a lot. We bring in quite a lot of talent in terms of professionals, whether it's in finance and in legal and many other areas, just to make sure that whilst we carry on the business of healthcare itself, that the business aspect of what we do is also kept going properly.
You're saying that part of your origins were the fact that black people were not given access to the greater health space. There have been complaints that the Clinix brand mostly does not employ local black doctors. Is that true?
It is not entirely true. So I think it's a mix, and what has happened over time is that, particularly in the 90s, as you would know, that there was a lot of influx of foreign nationals into the country, and it just happened at the time that we took advantage of that, and many of them were looking for a home, and many of them were willing to come and work with us in the townships. I think what has happened now is that the country itself... So you're not actively
excluding black professionals?
Not at all, not at all. In fact, we'll be delighted, to have local, black professionals joining. In fact, any black and white, because ours really has been a story of non-racialism, of having a just and a fair society. And those were the values that were espoused by the likes of Dr. Dumani. So we embrace all nationalities. We embrace our company, even in our executive team. We're quite mixed. In fact, our executive team, we have got predominantly black females. We have got white people. So it's quite a diverse group. And so we're quite proud of that, because really that's what the likes of Tata Mandela and Dr. Dumani were looking for. So
again, last year the country was gripped by the SABC scandal, where health professionals, educated and very senior, were seen not to be living according to their oath and their commitment to patients. Your clinic has taken on about 400 of those patients. How do you make sure that your employees do not neglect patients?
So the story of those long-term psychiatric patients, and about 150 of them died eventually. It's a very unfortunate story in the country, and we were in a way privileged, to be called upon by government at the time to assist. So as you say, we have got about 400 of those psychiatric patients. They are long-term psychiatric patients. We're housing them in our facility. It's a 640-bed facility. So in that facility, we run both the government section, but also we've got a private business that is consisting of psychiatry.
And they're well taken care of.
Physical rehab. We have got trained doctors who are stationed there pretty much 24/7. So we have got a team of psychiatric trained nurses. So I think it's because this is our business. This is what we run, every day, and we run, multidisciplinary, services.
So now you're partnering with the South African Scientists Society. Who are they? And tell us about these awards. How did they come about?
Very exciting time for us. I think, as you know, in our country, not long ago, we had, the tragic loss of one of the top scientists and healthcare leaders in the country.
Due to depression.
And when he committed suicide. We have now come together with the South African Clinician Scientists Society, group of young, vibrant, dynamic, young doctors. They're doing wonderful things, led by Dr. Salome Maswime. She's actually based in Harvard for the next few months, just sharpening her skills. She's the president of the society. She's not only an obstetrician and a gynecologist, but also she's got a PhD with quite a niche focus in research and just developing new thinking, and she speaks in many different international platforms. And the entire executive team of the South African Clinician Scientists are people who are really deepening excellence in the field of medicine. So we're quite privileged to be able to partner with them, and really our focus is about promoting clinical excellence. It's about promoting research and the discovery of new knowledge in the world of medicine, and we really quite a privilege to be partnering with them in terms of bringing the awards.
Who is eligible? We spoke at the beginning about the nominations closing on the 18th of October.
So there are a number of categories in the awards. So there's one, for example, that is the Research Excellence Award, and this is really to recognize those healthcare practitioners who have published extensively, and these will be people who have also traveled quite extensively in terms of presenting their papers. We've also got the one that is the Scientific Excellence Award, and that's specifically for people who have made a huge groundbreaking advancements in medicine, discovering identifying different and new ways of treating, existing diseases. Also recognizing people who have excelled as clinicians, in terms of their leadership and the training of undergrad and also specialists in the country. But also we are recognizing people, for their leadership skills. So people who have been leading both in business as well as in medicine itself as doctors, for over 20 years. So we'll be recognizing those. And then also we're recognizing emerging leaders. So we say if there are young, the doctors there who are doing, very interesting things and who are taking, leadership roles both internationally and locally, we want to make sure that not only are they recognized and acknowledged, but actually that they are supported so that we don't have any more of these incidents where people feel they are exposed once, they reach the top.
So are you debunking this constant assertion that we don't have skills in South Africa?
It's actually not true. South Africa, for many, many decades has, been part of the world in a way, a development of new, you will know the story of Chris Barnett back in the 60s, and there have been many other discoveries, since then. And so I think we always in the cutting edge. I think recently you'll remember that we had the quintuplets being delivered right in our hospital. Yes, you were in the news
because of that recently.
And it was global, we're getting calls and stories from people who are in the Far East, where they were hearing about this story, also in Latin America, and that went viral because fantastic. It doesn't happen often that 5 babies are born at the same time and they actually they live, and those babies are about to be discharged.
So what are the details if people are interested in entering?
So it's people can go onto our website clinix.co.za, and for more information they can just email us on healthawards@clinix.co.za.
Okay, we'll be watching how that story unfolds. Thank you so much for coming through to talk to us, Dr. Dumani Kula. He's the Deputy CEO at Clinix, a privately owned and managed health facility that's running those awards there.